As a student and as a medical resident and postgraduate trainee, I've always been interested in the brain and in neurologic disorders. My interest in Lewy body dementias stems from an overlap between Parkinson's disease and Alzheimer's disease. And during my career, these have been areas where many of my patients have had difficulty with these disorders, and where I'm impressed that we've made less progress than I would have hoped in terms of therapeutic interventions and responses to their needs. Well, one of the ideas underlying the work that I'm conducting now is that some of our limitation in progress in these disorders is because of their inherent complexity. And that is to say that the clinical diagnosis of a Lewy body dementia disorder is in fact a syndrome, not a disease, and that progress towards disease modifying or arresting the progress of symptoms probably requires understanding what each individual patient has pathologically going on. That is, the newer therapies that we hope will be discovered will require targeting to the specific problem each patient has. And this, looking at autopsy studies these days, is quite complicated in the Lewy body dementias. Well, that is ultimately our hope, is that looking at the biomarkers we're planning to study and are studying may identify the ability to select individual patients with certain pathologies and then to use that information to properly design therapeutic trials, with the ultimate goal that we hope to identify some therapeutic intervention that has a real impact on the progression of these diseases. Well, what we do in our laboratory is we focus on brain imaging and brain imaging of target proteins and other processes in the brain, relying on what we call molecular radiotracers. So it's fundamentally, in our application, a research brain imaging approach, where we, in our own laboratory, manufacture a radioactive probe with a very short duration of radioactive emission. We inject these intravenously, and we scan the brain to tell us about the pathology and the normal processes going on in the brain in life. Well, again, if we're successful with our current research proposal, we think we'll be able to better understand in the life of patients with cognitive problems and Parkinsonism which of several possible pathologies are ongoing. And if we're successful in that kind of classification in living patients, the immediate next step will be to confirm that with autopsy studies to be sure that we're as accurate as we believe we are. But ultimately, I think then this will promote the use of therapeutic trials targeting specifically Parkinson degenerative pathways versus Alzheimer's disease type degenerative pathways, and especially in those patients who have aspects of both.